Hello, how are you doing, guys? With you today, Dr. Muhammad Hamid, an ECVMG certified physician. And we have a case today, which is a high-yield case for the cardiology step 2/step 3 exam. And our case is about like the indication for mitral valve replacement surgery. So this is like 62-year-old symptomatic woman who is being assessed for cardiac evaluation after she have got like a murmur this was noted during like a pre-op assessment for a knee surgery, and she reports like no symptoms, very important, and the vital signs are normal, and the cardiac exam like reveals like a 3/6 late systolic murmur at the apex with a click, aka mitral regurgitation, and the echocardiography like shows a severe primary mitral regurgitation due to like bileaflet prolapse, and it shows also enlarged left atrium. 45 millimeter and left ventricular ejection fraction of 58%. And the question asks about what is the most strongly things that support this proceeding with mitral valve surgery in this patient. Is it like absence of the symptoms or the presence of the left atrial enlargement or the left ventricular ejection fraction less than 60% or the bileaflet mitral valve prolapse? So as an answer here is like the left ventricular ejection fraction less than 60%. So first you have to know like what are the indication to proceed for mitral valve replacement surgery. First, you have first condition is the presence of like severe mitral valve regurgitation plus the presence of symptoms. So whenever you have like the severe regurgitation plus symptoms, you have to go straight to the surgery. Second condition is the answer here is the presence of left ventricular ejection fraction less than 60%. So you may notice that left ventricular ejection fraction 60% is pretty normal for normal individuals, but you have to watch here for this patient to have like mitral regurgitation. The ejection fraction is gonna divided into some blood which backs up from the left ventricle and goes to the left atrium, and some blood who's gonna go straight into the aorta. So the blood is divided. So it is normal to see like ejection fraction of 70% or more. But if it is less than 60%, you have to go and do some mitral valve replacement surgery. The third scenario where you head to the surgery is the presence of left ventricular dilatation. So the presence of symptoms, the presence of left ventricular ejection fraction less than 60%, and the presence of left ventricular dilatation. So you have to gonna choose surgery in any of these three conditions. Absence of symptoms is a wrong answer because the presence of symptoms is already what when you are gonna go to the surgery. Left ventricular, left atrial enlargement. So chronic mitral regurgitation causes some load over the left atrium. So and over the long term, it is gonna accommodate and dilate. So this dilatation causes like an eruption of the cardiomyocytes, which transmit electrical impulse and create like aberrant foci. So these patients are gonna develop like chronic atrial fibrillation. So for you may notice in young individuals, they may get like paroxysmal atrial fibrillation. So this may go into acute AF, and after you stabilize this patient, everything is normal. But for these patients, they have like structural abnormality. So they have a high probability of their AF turning into chronic AF. And but here, the left atrial enlargement is not like a prerequisite or like it is not like an indication to go into the surgery. So remember the three indications: the presence of symptoms, the left ventricular ejection fraction less than 60%, or left ventricular like dilatation. So this is the correct answer here. It is left ventricular ejection fraction of 58%, which is less than 60%, and the bileaflet mitral valve prolapse is not an indication for surgery. I hope you guys enjoyed our video today, and thank you.